Vital signs. Skills required. The vital signs volunteer is responsible for accurately taking and recording vital signs of patients 5 years of age and up. A medical background provides the skills and knowledge required for this position. Completion of a vital signs training module and self-administration of the 6-question post-training quiz is required. The vital signs volunteer will greet each patient and call them by their first name. Introduce yourself by your first name and tell the patient you will be taking their temperature, pulse, respiration, blood pressure, and weight, and recording their results in their medical record. Do respect the confidentiality of the patient and their vital signs. Try to make the patient comfortable. Be aware of who is around when you are sharing information with the patient. You will record the results of your work on the medical exam form. We also provide physicals for other entities and would then utilize their exam form to record results, such as Lincoln Public Schools, HHS screenings, etc. Sanitation. You will want to use standard sanitization procedures, including cleaning your hands with sanitizer or washing your hands with soap and water before taking each patient's vital signs. If you choose to wear gloves, wear clean gloves for each patient. Pulse. Count heartbeats on the wrist for 15 seconds and multiply by 4 to determine the pulse rate. Document on the patient medical exam form. If the pulse feels irregular, count the pulse for a full minute and document the pulse rate on the exam form, as well as noting, quote, irregular beside the documentation. Respiration. Count the respirations for 15 seconds and multiply by 4 to determine the respiratory rate. Document the patient's respiratory rate on the patient medical exam form. Temperature. Take the patient's temperature using the device provided and following the directions on the device. Discard the probe cover and dispose of appropriately. Always use a clean probe cover. Record the temperature on the medical exam form. If we are getting low on probe covers, please let the team leader know so new ones can be ordered. This will help the team that serves the following clinic. Weight. Weigh the patient with shoes on. Record the weight on the medical exam form. Blood pressure measurement. Purpose: to maximize accuracy of blood pressure assessment. Background: in this clinic situation, it is impossible to follow patients with elevated blood pressure readings, as would be done in a primary care provider office. A diagnosis of hypertension could be made with a single reading. The American Heart Association guidelines for in-clinic blood pressure measurement provide the basis for best practice at Clinic with a Heart. Number 1. Seat the patient comfortably with back supported and legs uncrossed for 5 minutes before the blood pressure is taken. If possible, take the reading over a bare upper arm. An unsupported back may increase diastolic pressure. Crossing the legs may increase systolic pressure. Children should have their feet on the floor, not dangling above the floor. The patient should be quietly seated for 5 minutes before the reading. Rolled up sleeves if tight may create a tourniquet effect above the cuff. Number 2. Support the patient's arm at heart level. The middle of the cuff on the arm should be level with the right atrium, at the midpoint of the sternum. If the upper arm is below the level of the right atrium, the readings will be too high. If the upper arm is above heart level, the readings will be too low. If the arm is unsupported and held up by the patient, the pressure will be higher. Number 3. The cuff bladder should encircle 80% or more of the arm circumference. The most common error in blood pressure measurement is use of inappropriate cuff size. Considerable overestimation can occur if the cuff is too small. For correct cuff placement, the arrow on the cuff should be positioned over the brachial artery in the antecubital fossa. There should be a 2 to 3 centimeter space between the lower end of the cuff and the antecubital fossa, unless this would require an undersized cuff. In patients with morbid obesity, a large arm circumference with short upper arm length often cannot be correctly cuffed. In this circumstance, measure blood pressure from a cuff placed on the forearm, supported at heart level. Number 4. The patient and the person taking the measurement should not talk during the procedure. Talking during the procedure can cause deviations in the measurement. Other factors that can affect the measurement include exercise, smoking, muscle tension, bladder distension, room temperature, and anxiety. Number 5. If the blood pressure is greater than 140/90, wait 1 minute and repeat. Record both readings. We utilize electronic blood pressure machines. Manual equipment is also available if needed. Finishing. After recording all readings in the patient medical record, inform the patient the vitals are complete and the patient guide will escort them to the next area. Give the patient guide the patient's medical record and wish the patient goodbye. Self-administered true-false post-test. If the person having their blood pressure checked crosses their legs, the systolic pressure may be increased. True or false? A nurse should speak gently while taking a blood pressure to relax the patient. True or false? Using a cuff that is too small can result in considerable blood pressure overestimation. True or false? If the upper arm is below the level of the right atrium, the blood pressure is lowered. True or false? A person should be quietly seated for 5 minutes prior to measuring blood pressure. True or false? Because a bare arm is preferred, it is better to roll up the sleeve even if it's a bit snug than measuring the blood pressure through a shirt sleeve. True or false? You may check your answers on the next slide. If the person having their blood pressure checked crosses their legs, the systolic pressure may be increased. This is true. A nurse should speak gently while taking a blood pressure to relax the patient. This is false. Using a cuff that is too small can result in considerably blood pressure overestimation. This is true. If the upper arm is below the level of the right atrium, the blood pressure is lowered. This is false. A person should be quietly seated for 5 minutes prior to measuring blood pressure. This is true. Because a bare arm is preferred, it is better to roll up the sleeve, even if it's a bit snug, than measuring the blood pressure through a shirt sleeve. This is false.